Hi, my name is Dwayne Anthony Francis, and I'm a licensed clinical social worker here in the state of New York. And this video today is about how to start up a private practice in clinical social work as a sole proprietor. The first thing I did was choose my business's name, and I used my name and added my professional title. So my business is named Dwayne Anthony Francis, LCSW. You can operate under a different name, what's called doing business as, or operating under an assumed name by filling out additional paperwork, which I'll include a link to, um, and also a link for the employee identification number, which you'll get from IRS. Okay, so after I chose my name, I went onto the IRS.gov site and was assigned an employee identification number. Something that I took into consideration when I originally made this outline several months ago was locating office space. This is pre-COVID-19 quarantine. And so that was a consideration at that time, and there are several organizations that can help an individual find something pretty much for every pocket. You know, as far as a rental situation, if you want office space to yourself, there are office shares. There are what's referred to as virtual secretaries, which is access to Wi-Fi, printer, and fax. There are all kinds of situations out there and realtors that would be more than happy to help you in that area and looking for space. I, however, chose to operate online. I had done one-on-ones for a little while, but I find that I'm more comfortable doing online therapy. It works for me. Okay, so now um, if you're operating on a shoestring budget like how I was when I started, um, and it comes to your credentialization process, you're going to want to save money, you know, whenever you can. And so, two ways to do it is to look up a document signing company and also look up an online fax company or an email fax company and see if they have trial periods. That's what I did, and I got two trial periods, one for each of those, the last 30 days. I got quite a lot accomplished with that and decided to keep the services. So that's one way to save a few dollars initially at the beginning because money can be tight. Okay, and also if you go when you go into the IRS site, there is no charge. So if there's mention of a fee, you've gone onto the wrong site. There's not. It's absolutely FREE free. All right. So now you'll go on to a site called CAQH. And what they do is they collect and verify all of your information and have it all in one place. So that when you go to apply with uh, various insurance companies to be on what's referred to as insurance panels, they will in turn ask for pretty much the same information, which is a pain. But then they turn around and they validate that information with CAQH, and pretty much everything goes through, you know, on smoothly. I haven't had any problems registering with insurance companies. I've heard all these nightmare stories, but I didn't have one. Some of them are really quick to enroll. Some of them do take several weeks. One I would advise anyone to enroll with is Medicare. They're a good pay. It's a tedious process, but it's worth it because once you're in with them, it's a guarantee. Any day that you put in for reimbursement, 10 to 14 business days like clockwork, your money will be there, no hassle. At least that's been my experience. Okay, and you want to register with at least, I would say, 5 insurance companies. All right. Also, when it comes to advertising, it'd be a good idea to register with Psychology Today. That's what I did. I believe it was $29.99, and it's worth it. You know, I get advertising. I get majority of my clients come to me through that source, and also I get referrals from employee assistance programs or even health advocates. And it doesn't hurt to contact them yourself, make them familiar that with your practice, your hours of availability, if you're accepting clients, what your focal areas are. But Psychology Today was and is a good investment. What's fantastic about having a private practice, if you haven't considered starting one already, is that, excuse me, in this setting, you get to choose the number and type of clients you want to work with. And deciding the number of clients that you work with really is a big deal because that's not just going to determine your income, but it's also going to determine the level of stress that you will allow into your life and have to combat as you move forward working with your clients and practicing self-care. The last few topics I'll discuss will be billing, um, paperwork, and insurance. Okay, when it comes to billing, my suggestion is no matter how many insurance companies you apply with and are accepted to, at least maybe 3 or 4 of your initial clients. Take the responsibility of submitting those bills at least for the first few months or on your own, so that you can become familiar with the different insurance companies' billing processes and whatever sites they use. A lot of them these days don't even allow you to use their site, that they go through a site called Availity. And there are other such sites that are pretty much a one-stop shop where a provider can go and bill and also check in and see what resources are available to them from the insurance companies that they're enrolled with. Not every company like Ability covers every insurance company, but they're one that has the majority of the big names. Okay, so so it's a good idea to register with Ability also. All right, so um, other than that, where billings are concerned, you could decide to hire a billing company. I didn't do it initially. I didn't do it for quite a while because I had a low number of clients and I got used to doing the billing and basically pocketed that money. But now the practice is getting larger, and I most likely will end up hiring an agency to do the billing probably by the time winter rolls around. But for now, I'm submitting my bills on my own. Now, where paperwork is concerned, you definitely want to generate a letterhead. You want to get a HIPAA form. You can go onto OMH's site or the Department of Health and Hospitals and get a HIPAA form from there. You want to have a consent to treatment. In particular, you want to consent to telehealth treatment, considering what's going on now, and virtually all therapy is being given online at this point. So you want to consent for telehealth treatment. I added an acknowledgement of patient responsibility for payment, and that would be when the insurance companies, if there's a problem or it's a no-go with the pay, whatever, that's an acknowledgement that the client will accept responsibility. Something smart to add on also is a notice of cancellation and what fees are entailed in that process. I've used them in the past, not often, but they do help to make a client be consistent with appointments if they're one to be tardy or one to cancel last minute, and then you're stuck with this gap in time that you could have been earning income. And I don't charge them the amount of the session or anything like that. I charge them a nominal fee, and we just keep it moving. But you could add that. That's not a must. But you definitely want to have a letterhead. You want to have the HIPAA form, a consent for to treatment, for general treatment, one-on-one, and also consent to telehealth treatment. You also want to consent to release information, and that would be for billing purposes. Do not have a client sign a blank consent for release of information. Just put the insurance company's name in the spot for who information is to be released to, and allow the client to check off what information they want to release to the insurance company. Um, the last topic would be insurance. Now, here in New York, you're going to need $3 million worth of insurance. I know it sounds It's an imposing figure to say the least. But it costs just about $212 a year to maintain that type of insurance, okay? And you'll need to have that insurance in line to have any type of practice. All right, so that's what I have for you. I hope this has been helpful. I'm going to try my best to get the links in for you, okay? And let's see how that works out. If I'm not successful, again, for the employee identification number, it's irs.gov. And for the doing business as, you would go to your state's Department of State, Division of Corporations, State Records, and UCC for the doing business as. Alrighty, thank you for watching. Don't forget to hit that subscribe and like button. And I'll see you in the next video. Take care and thank you for watching. Bye.